So, madam, okay. So, good evening, doctors. I, Shuman, on behalf of Shield Healthcare, welcoming you all in today's session with Dr. Vidya, Tobbi, madam. And the topic of the today's session is lifestyle modification in PCOS. It's my honor to introduce ma'am. Ma'am is a professor and unit head of Department of Obstetrics and Gynecology, Al-Amin Medical College, Vijaypur. Chairperson, Food and Drug Medical Surgical Equipment Committee, FOXI 2018 to 20. National Corresponding Editor, FOX GOGI, Journal of Obstetrics and Gynecology Society of India. Organizing Chairperson, KSOGA 2016, Treasurer KSOGA. Madam was the EC member, KSC AGOI, Academic Council member, Women's University, Vijaypur, Al-Amin Journal of Medical Science, editorial board member, and UGPG examiner, paper setter, and PG guide. And Madam has a teaching experience of more than 30 years. So with the short introduction, I request Madam to take over the session, and meanwhile, I request all the participants for their active participation. And please post your queries on the QA dashboard on the Shield Connect page. So once the talk will be over, we shall have a short discussion on this topic with Madam. So thank you, Madam, and over to you, Madam.
Yeah, thank you, Dr. Suman, for those kind words. And it is always pleasure to talk on this topic. And thank you, Shield, for bringing out this important topic for the discussion today. So today I'll be talking on lifestyle modifications in PCOS. And we all know that PCOS forms a cornerstone whenever we get the cases of PCOS. Now, polycystic ovarian syndrome is a common condition with serious physiological and psychological health consequences for a woman. It affects women across their reproductive lifespan, not only adolescent, during reproductive age group, and even in the perimenopausal age group. It is associated with pregnancy complications, including gestational diabetes, preeclampsia, and then large gestational age babies also. And PCOS also is associated with obesity, excess weight gain, which exacerbates the health burden of PCOS. Now, whenever we are talking about the lifestyle management, first and foremost, we talk about weight management, then modest weight loss, maintenance of weight loss, and prevention of weight gain regain. And prevention of excess gestational weight gain is a first-line treatment for a woman with PCOS during and independent of pregnancy. Outcomes of weight management programs in women with PCOS are likely to be improved with the inclusion of behavioral and psychological strategies. So these strategies are targeting mainly for the improved motivation. So a lot of motivation is required for this lifestyle changes. Social support, psychological well-being are also very important. These can be applied to the clinical management of women with PCOS at different reproductive life stages. Now, main clinical and metabolic manifestation of polycystic ovarian syndrome according to women's stage of life. So these manifestations, they appear in adolescence, but disease seems to be originated in the intrauterine environment. We talk about Barker's hypothesis often. So there is a developmental programming. And if you see the PCOS during childhood or pre-pubertal years, we find there are various factors. It is a multifactorial disease. So genetic factors, in utero programming, there are increased AMH level, and during puberty there is premature adrenarche, hyperandrogenism, increased GnRS pulse frequency, increased AMH levels, ovarian volume, hyperinsulinemia, and during reproductive age group patients, they have irregular cycles, hyperandrogenism, subfertility, infertility. All those metabolic syndromes can appear in the postmenopausal years. There is again increased triglyceride, that is dyslipidemia. So at the later life, patients, these PCOS patients, they are at increased cardiometabolic risk factors with menopause and glucose intolerance, adiposity, and hypertension. So non-communicable diseases, they happen more often in these PCOS patients. There is a disrupted HPO axis leads to PCOS in women. So all these, we know how that there is a cascade of these factors like there is again associated hypothyroidism, hyperprolactinemia, hyperinsulinemia, dyslipidemia, then disturbed metabolites, which again lead to which affects the pituitary gland and the ovarian cycle and end organ, that is a uterus. So this disrupted hypothalamo pituitary ovarian axis lead to various other factors like hyperinsulinemia, hyperandrogenemia, dyslipidemia, disturbed gut microbiota. There are emerging evidences about this disturbed gut microbiota, obesity, and inflammation. Now, PCOS is an epidemic in India, and there are various complications of PCOD. If you see, there is an incidence of 41% and 117 million patients, and they are rising. Every 1 in every 5 women, they have PCOS. And the complications of PCOS, we know, like infertility, then obstetric complications like preeclampsia, JDM, preterm deliveries are on increase. Cardiovascular, we know that there are increase in myocardial infarction, hypertension, and in later life, these patients are more likely 5 to 10-fold increase in the risk of development of type 2 diabetes mellitus. Even because of endometrial hyperplasias, endometrial cancer is very common, and most important is the psychological. There are so many patients of depression, then anxiety disorders, and reduced quality of life. Now, we know about the symptoms and risk of PCOS. The main symptoms are hirsutism, acne, insulin resistance, weight gain, fertility problems, then irregular or sometimes patients, they have amenorrhea, anxiety, stress, depression, and obstructive sleep apneas, cardiovascular diseases, obesity, and type 2 diabetes. The patients can come with these symptoms, and then when we investigate them, definitely we find out that these are the patients of PCOS. Now, obesity and PCOS are very, very closely related, and obesity leads to insulin resistance, and that is a root cause of PCOS, leading to infertility. The PCOS is the most common metabolic abnormality in young women today, and it affects around 26%, 2 to 26% of patients during reproductive years. Now, obesity is also associated, which results in type 2 diabetes in long term. So, obesity, which occurs in 30 to 75% of the women of PCOS, increases the magnitude, total magnitude of hormonal and metabolic dysfunction in these patients. So, obesity and PCOS are closely related. And even we see some of the patients of PCOS with lean PCOS. So here also there is an insulin resistance in 80% of the women, and it is independent of obesity. And this resistance has been shown to worsen the reproductive and metabolic features, type 2 diabetes, and cardiovascular disease risk in PCOS. So the highest incidence is seen in women with marked hyperandrogenism and anovulation. So it is classified as non-modifiable risk factor for type 2 diabetes. Now, why lifestyle modification is needed? Now, we know that there is an insulin resistance, there is hyperandrogenism, and there is so many severity of factors which can be improved through lifestyle modification. One is dietary modification, physical exercise, behavioral changes, and some of the medications. Weight loss, which has got a positive effect on clinical improvement in menstrual function, fertility, pregnancy outcome, and endocrine parameters. Now, about the efficacy varies based on the type of lifestyle management and the type and characteristic of PCOS. Now, women with PCOS who are very obese, overweight, they are expected to benefit from lifestyle modification that results in adiposity reduction and ovulation. And it is very unclear these lifestyle modification is also effective in PCOS who are having normal weight. So it should be a primary recommendation in women with PCOS before prescribing any drugs. Now, lifestyle modification include first and foremost, which is diet, exercise, modest weight loss, prevention of weight gain again, and prevention of excessive gestational weight gain, behavioral changes, and if the patient has got some addiction like smoking, that she has to stop. Now, management of PCOS, whenever we talk of adolescent PCOS, always provide a psychological support. Treat the symptoms, treat the insulin resistance, and it is always integrated, individualized, comprehensive, scientifically designed, and multifaceted approach to address all aspects of adolescent PCOS. So the patient may require cognitive behavioral therapy. You can take a help of counselor, or even sometimes if the patient is having some eating disorders, maybe psychiatrist is required. Exercise plan, nutrition plan and diet, addiction awareness plan, and sometimes some nutraceutical complementary or pharmaceutical agents. And if BMI is more than 30, is morbidly obese, sometimes we have to advise these patients bariatric surgery and weekly support and re-entry. We have to follow these patients often. Now, there are various studies, Cochrane data is there, how this lifestyle behavioral management of polycystic ovarian syndrome affects and what is its outcome. Now, whenever the patient comes, you have to take assessment history. First and foremost, you have to calculate her BMI, waist to hip ratio to determine the degree and distribution of fat. Various hormonal assay can be done like LH, androgen, glucose and lipid profile, and ultrasound. And if obese, assess and treat obesity and other related comorbidities. Now, I was talking about cognitive behavioral assessment. First is screening for depression, mood, and eating disorders. Assess the mental barriers and readiness to change. That is most important. Devise her lifestyle modification strategies with patient and family. Family is also equally important, because if you go on advising the patient, and if patient cannot afford or patient cannot take that, the follow-up should be with the family as well. Tackle the addiction like smoking, alcohol, caffeine, and other food. Now, dietary counseling is very important. Like, you should always advise, we will talk about it later, but always advise them to take low glycemic index and calorie restricted food. Aim is to achieve weight loss of 5 to 10% of body weight over 6 months. We cannot advise these patients a crash dieting. Then second most important is the exercise. Daily moderate exercise for 30 minutes or more, high intensity for 60 minutes is advised. Pharmacotherapy, I'm not going to discuss here because it is a separate topic. Maybe in the next topic, I may discuss these also next week or next month. These are anti-androgens, metformin, and bariatric surgery. The regular review is very important. That is whether the patient is following your advice. Reinforce goal for weight loss, maintenance of discipline, and prevent the weight regain. That is most important. Now, whenever we are talking about weight loss and PCOS, a 5% loss of body weight will reduce insulin resistance and circulating androgens, resulting in spontaneous ovulation and improvement of symptoms. The woman with WHO group 2 anovulatory infertility with PCOS who have BMI of 30 or over, and weight loss alone may restore ovulation, improve the response to ovulation induction agents, and have positive impact on pregnancy outcome. Now, there are various benefits of this weight loss. In addition, weight loss also causes significant reduction in central fat deposit, around 11%, and serum luteinizing hormone levels with return of normal menstrual cycle in 4 out of 5 women in one of the studies. There are again various studies which has got outcome like weight loss in 6 months. So right from 95 to 2004, and some of them they have ovulated, some of them they got pregnancy also just by implementing the weight loss. Then how we, this is very, very important, how you will counsel the patient on diet and nutrition. So that positive impact you should give to the patient, that what are the benefits, and you can show what is the outcome of weight loss. Now, what are the dietary interventions whenever we are talking of tailoring of dietary changes to food preferences, allowing for a flexible and a individual approach to reducing energy intake. Avoid unduly restrictive and nutritionally unbalanced diet, which is very important. So you have to restrict unbalanced diet and give them a nutritive diet. Both are important. Now, what has changed over the period? Earlier, our plate was like this, means we were using vegetable and fruits, then cereals, milk and milk products, and pulses, and non-vegetarian food or sugar and fats. Now, the modern new five foods have, home food has decreased so less. You can see here green, and the cold drink, fruit juices, bakery products, chocolates, and junk food has taken the toll on our health. Whenever we are talking about the weight management, weight loss tips should be given to this PCOS woman. She has to reduce her carbohydrate intake. And 70% of the women with PCOS, they have insulin resistance. High levels of insulin with increased body fat and weight gain is observed in this woman, and that's why the low glycemic diet benefits. So eating a low glycemic index, low carb diet may reduce insulin level in women with PCOS, which helps in the weight loss. Now, cut down the calories, especially in the evening. Studies have also shown that the calorie restricted diet may help to normalize the hormones, induce ovulation, and treat infertility. And most of the health professionals, they recommend creating a calorie deficit of 3,500 to 7,000 per week for a healthy and successful weight loss. Now, optimal meal pattern. So you should tell these patients to eat a small, frequent meals and snacks. Not only that decreases the food cravings, but it also provides a steady flux of energy and helps to prevent hypoglycemia. Consume breakfast within 1 hour of getting up, as it is generally recommended to spread calories throughout the day. So morning, our cortisol levels are very high. Now, whenever we are talking about the glycemic index, what is it? It is a measurement how quickly a particular food raises the blood sugar. So glycemic index ranges 0 to 55, that is a low glycemic index, 56 to 59 medium glycemic index, and 70 plus is a high glycemic index. And these are the some of the grains, starches, or vegetables, fruits, dairy, and proteins which have a different glycemic index. This you can remember. So that should be stomach filling as well as with the less glycemic index. So you can make combinations of proteins and the starches in various proportions to decrease the glycemic index as well. Now, you can give the snack options like various nuts. So we know various nuts have got less glycemic index, so they can provide you a nutritive value also, as well as they provide you various vitamins. And this one simple glass of charge or buttermilk also is one of the good option. Now, another thing is very important, that is the fibers. So high fiber diet may improve weight loss, and ICMR recommends that daily diet of adults should contain at least 40 grams of dietary fiber. So you can consume variety of grain products like whole grains, and at least you should choose 4 to 5 servings per day of fruits and vegetables. So fruits and vegetables, they contain lot of fibers. And along with this, adequate water intake, that is hydration, is very, very important. And it has got its own benefit, that it reduces the insulin resistance, body weight, excess fat also. So these fibers and the water, hydration both helps. It lowers the risk of developing cardiovascular disease, stroke, hypertension, diabetes, obesity, and some specific gastrointestinal diseases as well. So we know about these benefits. That is, it decreases the insulin resistance, lowers blood sugar, lowers cholesterol, lowers high blood pressure, improves gut biota, that is microbiota. This is there is emerging evidence. Then reduces hunger, aids in the weight management, minimizes carb craving, prevents constipation, and lowers the androgen levels. So these are the various high fiber food for PCOS like whole grain, green leafy vegetables, various fruits, peas, beans, and spinach and broccoli. So the spinach and other things, they are very plentifully available at rural areas. Now protein intake is very much necessary. It helps to stabilize blood sugar, increases the feeling of fullness after a meal, and high protein intake may boost weight loss, especially for women with PCOS. In one study, the 57 women with PCOS were given either a high protein diet and more than 40% calories from protein, 30% of the fat, or a standard diet consisting of less than 15% of protein and 30% of fats. The women in the high protein group lost an average of 4.4 kg after 6 months, significantly more than those in the control group. So this is one study which is published in favor of protein intake. Now, what are the various sources of proteins for PCOS? Healthy high protein foods include eggs, nuts, dairy, meat, and seafood. Always we think that the proteins are only non-vegetarian food is rich in protein, but there are vegetarian sources of these proteins also, which are plenty. So we can eat nuts, dairy, milk. Milk is a good source of protein. And then what about fats? So plenty of the healthy fats in the diet may help feel more satisfied. And as well as it tackles the weight loss and other symptoms of PCOS. Fats are rich in calories, and adding healthy fats to meals can expand stomach volume and reduce hunger. This may help PCOS patient to eat fewer calories throughout the day. So one chammach of ghee will have so many calories. So we can reduce the other part of your meals and that give you fullness and more satisfaction. And fat intake is also linked to reduced hunger. That's what we always take one chammach ghee, in our usually vegetarian food. And there is a greater loss of body fat. Example of healthy fats as avocado, olive oil, coconut oil, and nut butters. Now, these are the various healthy fats, good fats like olive oil, nuts, and coconut and salmon. And bad fats also you should remember. These are vegetable, animal fats, shortening, soybean oil, all those are bad fats. So why we need the fats? We all know that the nutrient absorption, the A, D, E, K, these are the fat soluble vitamins. The fats are very good for healthy skin and proper functioning of the brain, the production of hormones. Many things are dependent on the fat intake also. Yes. So if you don't eat at all fat, you have other side effects as well. Now, what about fermented food? Why we should eat some of the fermented food? And there is, as we were discussing about the microbiota. So prebiotics and probiotics, there is always a disruption if you are sick. So women with PCOS, they have fewer healthy gut bacteria than the woman without this condition. So healthy gut bacteria, they play a role in metabolism as well as weight maintenance. So certain probiotic strains may have positive impact on the weight loss. So eating foods high in probiotics such as yogurt, idli, dokla, and dosa, other fermented food may help in increase in the number of beneficial bacteria in your gut. So probiotic supplementation aid in this management of these patients. So what we advise is to minimize the whole fat dairy products such as butter, ghee, and whole milk. Reduce cholesterol intake less than 30 300 milligram per day. MOFAs, that is in nuts that help in to fight the insulin resistance associated with PCOS. Use low-fat cooking methods like baking, broiling, grilling, boiling rather than frying. And don't use repeated fried oil for your use. Now, practice mindful eating, which is very, very difficult. So these PCOS women are 3 times more likely to have eating disorders. So whenever they get depressed, they go on eating. So mindful eating helps to promote awareness of internal eating cues and may promote weight loss. So you always tell these patients to avoid processed food and limit added sugars. So what these processed food and added sugar, they raise blood sugar, that is glycemic index is very high. And that's why they increase the risk of insulin resistance, which is again linked to the obesity. There are various researches that shows that women with PCOS, they experience larger spikes in blood sugar and insulin levels after consuming the same amount of sugar as women without this condition. The processed foods such as refined carb, cakes, cookies, pastries, these are various fast foods and they have got added sugars. They increase blood sugar very fast and also they help to put on your weight. So these, remember these pictures, they are very attractive and attractive to the adolescent, of course, and others also. So the chocolates, cakes, pastries, shakes, processed milk like chickens and sausages, nuggets, these are all unhealthy choices. Now, what about inflammation? So chronic inflammation is common in women with PCOS, which is linked to obesity again. Sugar, processed food, they can contribute to inflammation. In one study, 16 women with PCOS who took one-time dose of 75 grams of glucose had higher blood markers for inflammation compared to normal women. So we always tell to take a Mediterranean diet, which is high in fruits, vegetables, whole grains, olive oil, omega-3 rich foods such as fatty fish may protect against inflammation. We all know the pyramid. So what we should take less often, weekly, then twice each week. So we have to divide our food options also. So lot of vegetables, you can imagine the plate. So in that plate, half 4 parts you can make. In one part, your half part you can put vegetables and fruits. In 1/4 you can put proteins and in 1/4 carbohydrates. That can help. So our Indian diet is actually a complete meal. So it is a healthy plate. If you can imagine what we used to eat early. So it had a dal, which is rich in proteins. Then sabji, it has all vitamins, minerals, and carbohydrates. We had the raita and salad, which was rich in fibers and micronutrients, carbohydrates in the form of chapatis or rotis, and various curds also, which had the probiotics. So it is a complete meal ours. So diet does not mean to undereat. So always we talk of doing dieting and dieting. So dieting is not to tell the patient that you have to undereat. So chronic calorie restriction also slows down your metabolism and it leads to again weight gain. Eating too few calories can also negatively impact hormones that control appetite as well. So in one study, the restrictive dieting was found to modify the hormones like leptin, peptide, cholecystokinin, insulin, ghrelin, which increased the appetite and led to weight gain. Instead of restricting calories, it may be best to focus on eating whole foods and cutting out unhealthy products. And eating more vegetables and whole foods while reducing the consumption of processed food, refined grains, and added sugars may help promote weight loss without restricting calories. This is the Gita of diet and restriction of health. So one should always talk about the smart choices, what they can eat. And you can put, and how to cook is also very important. How to how much they, all these our dietitians also, they tell to eat green leafy vegetables in various proportions and all, but cooking sometimes loses its nutritive value. So you can apply your mind, and there are various recipes which you can accommodate to make it tasty for them, and variety of food daily you can provide the variety of food to these women, and tell them to prepare it differently. Definitely they follow your advice. And this is what is important, that these food safety and standards, they have put on diets for the school regulation in 2019. It bans the sale and marketing of junk food inside the school and within 50 meters of the school campus. This is very important because obesity in adolescent is on rise, and it is about 22% adolescent in India, they are obese. So no junk food high in fat, salt, sugar can be served in the school cafeterias or midday meals or in the hostel. So junk foods, you have to junk them. So we should not, though they look very attractive, very tasty, we should junk them. And second is the impact of television and media. So it has got the largest share of advertisement during children programming and food products. And most of our children, they are very much addictive to the TV. Always they eat the food while observing and looking at TV. So these advertisements, they show food with low nutritive value. Okay, even biscuits and various boost is a secret of energy. We what we talk, but what is the content of that we never see. So this is very important message one should give to our patient. So healthy eating is always hygienic. So you can modify the recipe modification, reducing the salt, sugar, and fats in the recipe. The portion size. See, if you take the small plate and put so much of vegetables, it looks large. So portion size is also important. Regularization of the meal at proper time, the person should eat. The woman who is having PCOS and obesity, they should always eat in time and always eat balanced diet. So respect for food is a respect for life, for those who are and what we do. So lifestyle modification does not have an expiry date. So you have to follow certain rules and regulations. Sometimes we advise the nutritional interventions. We feel that these are the vitamins. We always prescribe multivitamins like vitamin A, vitamin B, inositols, which are insulin sensitizer, vitamin D, vitamin E, then carnitines, and then whatever deficiencies we find. And especially the most important deficiencies are the minerals like calcium, magnesium, chromium, selenium, zinc, and other supplementations are required in the treatment of PCOS. So overall effects of nutritionals in PCOS. So they act at various levels. We know about the PCOS pathogenesis. There are hyperhomocystinemia, insulin resistance. There are environmental factor, oxidative stress, and these are the various nutritionals that act at various levels. Now, there are studies on zinc, there are studies on magnesium, then myoinositol, so many studies, inositols are, these are the compounds, they manage the weight and symptoms of PCOS. So myoinositol is a supplement that may lead to weight loss in some women of PCOS, and they are related to B vitamin that helps to improve the insulin sensitivity. Myoinositol is a specific form of inositol. I'll not go into the details, but there are so n number of studies for the management of PCOS with and supplementation of these myoinositol. What about the psychological intervention? The psychological intervention and both individual and in group should be provided. This intervention is necessary for following problems. One is behavioral problems are very common. Abnormal eating patterns, damaged self-confidence due to acne, hirsutism, and obesity, increased levels of anxiety and depression. So psychological intervention forms the mainstay of the treatment and is the first step in the management of PCOS in adolescents. So what behavioral strategies? One is goal setting, self-monitoring, stimulus control, problem solving, assertiveness that you have to do this, assertive training, slower eating, reinforcing changes, and relapse prevention. These are the behavioral strategies we can tell them to adopt. Exercise, which is another side of the coin whenever we talk of PCOS lifestyle interventions. Physical activity like exercise combining with PCOS diet provide the following benefits. One is improves the weight loss, improves the insulin metabolism, more regular periods, regular reduced level of male hormones and male pattern of hair growth, and it also lowers the cholesterol levels. There are studies confirming benefit of exercise in PCOS. In a 12-week study in which 16 women did 45 to 60 minutes of cardio 3 times per week, those with PCOS lost 2.3% of body fat compared with 6.4% in control group. While women with PCOS lost less fat than those without this condition, the exercise regime did result in loss of belly fat and improvement in insulin sensitivity. So weight training is also very helpful. In one study, 45 women with PCOS did weight training 3 times weekly. After 4 months, they lost again abdominal fat and gained lean body mass, while reducing testosterone and blood sugar levels. So this is a writing of the exercise prescription, that is FIT VP. This short you can remember. F is frequency, 5 days a week. I is a intensity, moderate intensity. You cannot ask them to suddenly to do strenuous exercise. T is type, that is aerobic exercise. T is time, 30 minutes per day. And FIT, that is 150 minutes per week, moderate intensity. P is progression, start slow, go slow. So those who are steady and slow win the race. So these are again PCOS exercises recommendations. So there are so many studies which has various inferences, like insulin resistance has reduced, improved flow mediated vasodilation. Then there are changes in the hormones, lipolysis. So many advantages of exercise as are the weight loss. So weight loss and exercise go hand in hand. So the conclusion of these studies, so many studies they have done, is it improves the body composition, restores the insulin sensitivity, enhances the adipose tissue lipolysis, and also because of endorphin release, improves the depression. So exercise intervention in adults, minimum of 150 minutes per week of moderate intensity physical activity, 75 minutes per week of vigorous intensities or equivalent combination of both, including muscle strengthening activities on 2 consecutive days per week. Now, physical activity, leisure time, physical activity or walking or cycling, occupational work, household chores, games, sports, or planned exercise. You can choose amongst them. Daily 10,000 steps is ideal, including activities of daily living and 30 minutes of structured physical activity. So what type of exercise in PCOS? So there are various yoga poses for PCOS. Moderate exercise are all great activities that can help with PCOS. So either a brisk walking, stretching exercise, jogging, Zumba dancing, cycling, swimming, all these combinations can be told to the patient. This type of exercise increases the body sensitivity to insulin, which reduces the risk of cardiovascular disease and type 2 diabetes. And remember the 3S for PCOS, that is for the hormonal balance. One is stress management. While the chronic stress is one of the key driving forces in PCOS. So it increases the inflammation, worsens the insulin resistance, increased the androgen production, not to mention the negatively it impacts your emotional well-being. That is one. Then sleep is a master reset button. for your hormonal state. We know that in sleep, the melatonin is secreted, and the lack of sleep can also impact these hormones and energy, hunger, craving, performance, everything. So quality sleep is incredibly vital to overall hormonal health, and that's why the sound sleep is very important. And the supplementation, that is another S. So there are various specifically needed nutrients, and that can be given to these patients for reduction of inflammation and various deficiencies. The sleep, first one we will discuss about sleep. Most of the patients of PCOS, they experience sleep disturbance. So and then they don't sleep in the night. They have excessive daytime sleeping, sleep apnea, and insomnia. And this increases the activity of hormone that drives the hunger, such as cortisol, and which again causes to eat more throughout the day. So insufficient sleep is associated with higher risk of being overweight or obese. So there are again 18 studies which found that those who slept less than 5 hours per night were significantly more likely to be obese. The study also demonstrated that every hour of additional sleep per night was associated with decrease in the body mass index of 0.35 kg per square meter. The studies have linked better quality of sleep to fat loss. So in one study, the healthy adults who slept less than 6 hours per night had 12% higher risk of developing abdominal deposition of fat compared to those who slept 6 to 8 hours a night. Now, we always talk of this oxidative stress, which is an association between oxidative stress and PCOS. It is a very important issue in the whenever we talk of PCOS. So there are cumulative studies to date which yield an association between the two. So there are how this oxidative stress affects. There are free production of free radical, and the whole balance is disrupted by various in various forms. So there are various environmental factors, nutritional factors, and all those factors that affects this oxidative stress. And the other stress, that is stress which is the psychological, physical, other stress, that also increases the levels of cortisol. So chronically high levels of cortisol are linked to insulin resistance and weight gain. And chronic stress also increases the risk of developing again abdominal deposition of fat. So in turn, these fats deposition of fat increases inflammation, and which triggers the body to make more cortisol. So there is a vicious cycle. So to lower these cortisol levels, focus on the stress management practices. So there are various techniques like meditation, we talk of yoga, spending time in nature. These all are the things you can advise to the patient, which helps to lower their cortisol levels. These are the relaxation techniques. We talk of pranayamas, deep breathing techniques, meditation, rhythmic exercises, and yoga. So these are the various benefits. One is heart rate regulation. Breathing becomes slower and deeper, blood pressure stabilization, muscle relaxation, and the blood flow even to the brain is increased. So these sessions, one should always advise, like pranic psychotherapy. There is various chakras we always describe, no, Mooladhara to so many chakras. These this activation is also, they say that definitely it helps. So some of them, they have published the studies also. We have got this Vivekananda Center in Jigni. If anybody wants to join there are various courses also. So they have studied the effects of the chakra and the relaxation techniques. Even there are various techniques, sound mind resonance techniques are also there for the stress management and exercises. Now, we also know about the various environmental factors which also affect the hormones and infertility. There can be physical, and also there are environmental factors like light, temperature, radiations, chemicals, natural and synthetic chemicals, biological like viruses and microorganisms, behavioral stresses, and addictions, socioeconomic, even nutrition and habitat, occupation. We talk of pollution. And these hypotheses on environment, they say that these are the various environmental toxins and that disrupts the endocrines. And that also, and another factor we are talking about is the gut microbiota. So socioeconomic status and advanced glycation and products, dietary intake, it affects the dietary intake together with tobacco, the addiction, that these are the things that represent more important source of exogenous factors, including cooked fast food diets, uncooked animal derived diets, and high protein and fat content and thermal processing of various foods. These all affects and disrupts our whole cycles and milieu. So at the end, just take home message: obesity and sedentary lifestyle in PCOS is associated with anovulation and failure of infertility treatment. And lifestyle modification like weight loss and exercise prior to infertility treatment can improve the ovulation rates, and recommended as first line treatment when the PCOS is one major factor for infertility. They also break the chain which pulls the patient from PCOS to NCD, that is non-communicable diseases. The best exercise regimes are not known yet, but the calorie restriction and increased physical exercise, they are recommended. Now, the lifestyle modification is the first step of PCOS management as recommended by multiple guidelines. So you have to tell them to maintain the healthy weight, have a regular health checkup, keep your stress in check, exercise, re-energize, and if you have any addictive things, you have to stop them. So it is easier to build up a child than it is to repair an adult. So family does matter whenever we are dealing with the PCOS patients. Thank you for the patient hearing, and I thank Shield for giving me this opportunity to share my thoughts on lifestyle modification. Thank you very much.
Thank you very much, ma'am, for this nice presentation. As we have understood, lifestyle in modification or lifestyle management, it's a big things to combat this PCOS. So just give me 1 minute, ma'am, to find the question. So the first question.
Hello, I will share my email ID. If they have any more questions, they can also ask me through the mail also.
Okay, madam. Thank you.
Good evening, madam. Can I ask one question directly, ma'am?
Yeah. May I know who is speaking?
I am Dr. Sudhamani, ma'am.
Hello. Namaste.
Yeah, hello, ma'am. Namaste. Ma'am, I have a patient. She's having PCOS and she's around 25 years. And she's on treatment and her prolactin levels are more than 400, 500 and she is infertile. How to go about in this patient, ma'am?
See, her prolactin levels are high, so you have 400 means you have to investigate for the causes of hyperprolactinemia. I think you have done her thyroid levels and other workup also. What is her BMI and how much obese she is? So
BMI is less than, yeah. Okay, ma'am. Okay, carry on.
So have you checked her thyroid profile and what is the cause for her hyperprolactinemia? So you have to take the help of endocrinologist in this patient and find out any pituitary problems are also there. Have you talked with the endocrinologist?
Yes, ma'am. She is on treatment with the Capgolin. Yeah.
Capgolin. How much you are giving Capgolin?
3 days a week, 2.2 mg, I think.
Yes. So you give her and you check her prolactin levels again, and simultaneously you check the other causes of also hyperprolactinemia. And main thing, I feel that her thyroid is also to be checked, na? That also. And what about her lifestyle modifications? She is obese. I think her connection got lost. but this is hyperprolactinemia, 400 levels. I think that has to be treated. She has started a right treatment like cabergoline. She has started, and simultaneously her thyroid levels, thyroid profile has to be checked, and if her TSH levels that to be monitored, and other cause of infertility. If she has got other causes of infertility, it has to be treated. Thank you very much.
Okay, thank you, madam. And ma'am, another question is lifestyle only implicate for the obese PCOS or lean PCOS also?
PCOS also have to exercise. See, there is lean pieces. The what we talk of is the type of fat deposition where it happens. So even though lean, there is some amount of insulin resistance in lean PCOS also. So in those patients also, we advise them to do exercise and increase their.
Okay.
Yes.
And do you, ma'am, means in your practical practice, is there any specific advice to your patient while they are having their ovulation induction in terms of this lifestyle management?
See, it all depends on the cause, type of the patients they come. Suppose the PCOS, obese PCOS, they come with infertility. Definitely, I will ask them to do lifestyle modification and weight loss. And this weight loss, we have to counsel them for their nutritional advice. So once they minimum at least 5% weight loss, if they happen in within 6 months, that is also very much helpful. So exercise, then weight loss, and I will find out what are the other causes of infertility in these patients. And even in ovulation induction, as you were talking on, PCOS patients for ovulation induction, whenever they are coming with us, I practically tell them that obesity is one hindrance, and it has got many consequences like anovulation and all. So simultaneously, the treatment for infertility, ovulation induction, as well as lifestyle modification, 3 should go hand in hand.
Thank you very much, madam, for this valuable presentation and nice discussion. And in future also, we look forward for some valuable sessions.
Thank you very much. Thank you very much.
Thank you.